Hello friends, this is Dr. Abdul Mubin A. Mundewadi from Mundewadi Ayurvedic Clinic. In today's video, we will discuss the Ayurvedic herbal treatment for a disease known as Ischemic Optic Neuropathy. This is known in short as ION. Now this is a medical condition in which there is sudden vision loss, either complete or partial, due to a disrupted blood supply to the optic nerve. Now this is of two types, anterior which is more common and posterior which is comparatively less common. Now anterior ION relates to the disease which is confined to the retina and the immediate adjoining part of the optic nerve, whereas posterior ION is related to pathology which affects the distal part of the optic nerve, often away from the eyeball. Now anterior ION is again of two types, arthritis and non-arthritis. Arthritis type relates to inflammation of the arteries, more usually associated with giant cell arthritis. Now this condition is common in women especially over 55 and is associated with generalized symptoms such as fever, fatigue, body ache, in addition to localized pain. There is usually a temporary blurring of vision before permanent vision loss occurs. Now fluorescein angiography is diagnostic of this condition, and steroids are used in this condition to protect the unaffected eye. Now non-arthritis neuropathy. This is a comparatively more common than the arthritis type and is seen in both sexes and at any age. This condition is usually caused due to sudden reduction in the blood pressure. Medical conditions with an increased risk of non-arthritis type includes diabetes mellitus, rheumatoid arthritis, herpes zoster, anemia, sickle cell disease, and drastic changes in the blood pressure, gastrointestinal ulcers, heart disease, vasculitis, and migraine. Lot of conditions. Now this condition is characterized by a sudden and painless vision loss in one eye, usually on waking up from sleep. The management of this condition includes treatment of the underlying cause, especially aggressive treatment of cardiovascular disease. Now Ayurvedic herbal treatment depends upon the cause of the disease. If inflammation of arteries is the cause, herbal medicines which have strong anti-inflammatory properties are used in high doses in order to prevent loss of vision or salvage the maximum possible vision. Treatment is given to treat inflammation and blockage within the arteries and capillaries and to remove toxic components within the circulation so as to prevent or reduce damage to the retina and optic nerve. Now the non-arthritis type is usually treated according to the known cause of the disease as well as the accompanying symptoms. Treatment is usually given to treat inflammation, stabilize the nerve cells within the retina and optic nerve and improve circulation and remove toxins and debris from the eyes. Now for any type of this disease, Ayurvedic herbal treatment is usually given for periods ranging from 6 to 9 months in order to bring about maximum possible remission of the symptoms and restore vision to the maximum extent possible. Now this treatment, Ayurvedic treatment, consists of oral medication and some Panchakarma treatment modalities are added to that too in order to bring about faster relief and better relief. Now these Panchakarma treatment modalities are important and different modalities may be used. But usually Shirodhara, Netra Tarpan and Rakta Mokshan using leeches, these can be used. And in addition, medicated enema, also known as Basti, all these can be used. These do have an effect on the inflammation and they can prevent further damage and restore reverse the damage that is already present. So in this way, Ayurvedic herbal treatment has a significant role to play in the management and treatment of Ischemic Optic Neuropathy. So friends, this is a short description of Ayurvedic herbal treatment for Ischemic Optic Neuropathy. Let's meet in the next video. Goodbye.